I pulled the discussion of ageism out of your regular chapter overview for a reason. Because of the way it was embedded within the chapter, it was difficult to separate it from the normal aging process. And the two seem to be confused in one conversation that may have led people to not, especially new people, to not understand the difference between what is normal aging and what would be considered as ageism in your perspective. I want to give you two slightly different definitions. The first is from the textbook, and the second is from an article on ageism by a person who writes about this on a regular basis. Ageism can be defined as a prejudice whereby people are categorized and judged solely on the basis of their chronological age. The second definition is that ageism is the denial of basic human rights of older persons and is considered one of the most pervasive prejudices across human society. In short, ageism is prejudice. Over time, the standing of older adults has gone from one of respect to one of commanding little respect. For many reasons, this is problematic, but one of the most significant is that it reduces not only life expectancy, but the quality of life. Implicit ageism is defined as thoughts, feelings, and behaviors toward elderly people that exist and operate without conscious awareness or control, with the assumption that it forms the basis of most interactions with older individuals. One study found that 95% of participants had negative views about older adults. When any form of prejudice is implicit, it frequently, almost always, means that you are not conscious of the prejudice that lives within you or the biases. Frequently, when it's implicit, we often refer to it as bias rather than prejudice, although it's a nicer way of saying the same thing. What does ageism look like in practice? One of the ways that you might recognize it is through elder speak. And elder speak is the equivalent of it, well, it's similar to baby talk. But when we're talking to a baby, we are not harming it, we're actually teaching it language. And it learns something from that, and you tend, when you're doing baby talk, to speak in a higher tone, and babies are very attuned to that higher tone. When you do that with older people, it is called elder speak, and it's considered condescending. And it is a condescending way of speaking to older adults that resembles baby talk with simple, short sentences, exaggerated emphasis, repetition, and a slower rate and higher pitch than in normal speak. You need to understand that a lot of people, when they do this, they think that they are being compassionate. But there is a big difference between compassion and condescension. And elder speak is basically being condescending toward people. It is treating them as if they are not in full control of their faculties. And the truth is, the majority of people over 65 are very capable of understanding adult speech. And to treat them otherwise, then, is inappropriate. The other problem with using elder speak is that if you're speaking in higher pitched tones, especially for men, their hearing deficits largely are at those higher pitched tones. So in reality, you're speaking in a tone of voice that is more difficult for them to hear. There have been many studies done on ageism. One study found that 80% of respondents to the survey reported experiencing ageism, such as assuming that they had memory or physical impairments. Another study out of Duke in 2001 showed that 58% of respondents had experienced being told a joke that pokes fun at older people. 31% reported being ignored or not taken seriously because of their age. The study was printed in Gerontology in 2001 and really went into some detail about what older adults do experience. Some of the effects of ageism result when we treat people as frail. And if you treat people as if they are frail, they become less independent. One of the common examples is young people thinking that older people should sit down, stay still, move less, and that the younger people should do things for them. One of the problems with that is one of the ways you maintain your independence is to do for yourself. It maintains your mental acuity, your physical activity, your strength, your flexibility. In all ways, it is good for you. The other problem is when we try to make older adults fit the norms of younger adults. When you norm something on a specific age group, what you find out is that the norm then is unfair to the age group you're comparing them to. And we saw this, we've seen this previously when standardized tests or evaluations of moral development were normed on adolescent males. And then when you apply those norms to adolescent females, you say, well, they're less morally developed because they don't meet these standards that we standardize based on the adolescent male, rather than realizing that they are different. If one views themselves as old, then the person may ignore self-care, social interaction, and treatable symptoms. And in many ways, this is self-stereotyping. If you self-stereotype yourself as old, then you will live up to the stereotype that you gave yourself. So it's really important that one views themselves as a productive, active, intellectually, physically engaged person that has a lot to offer and years to live. And when you do that, then you become more engaged in your own care. And then one of the other effects of ageism is those with more positive self-perceptions of aging live 7.5 years longer than those with negative self-perceptions of aging. So much of our self-perception is developed in our youth and in our early adulthood. It is how we are taught to see ourselves. Our parents teach us how to see ourselves, our friends, our teachers, and society and culture as a whole. And if society is telling you throughout your life that when you are older, that you are less physically fit, that you are going to have memory losses, that you have all these negative associations with aging, then that is going to impact your self-perception. As opposed to, 40 or 50 years ago even, when the major perception of the elderly wasn't that they were frail, but that they were wise and caring. And that is a very different perception than what we are teaching young people today. Ageism also exists in nursing, and we need to be very aware of this as nurses. Ageism contributes to poor health outcomes in older adults. It results in workforce shortages through exclusion of aging nurses. And while I say in nursing is not the only profession that this would be the case. There are professions, police officers, firefighters, pilots, military, that actually limit your age and make a mandatory age at which you must retire. The United States is one of the few countries that overall does not have a government-mandated retirement age, but many countries do. Ageism creates oppression for not only the patients, but also for the nurses. And then we have to remember that there are countries like the UK where ageism is not even illegal. And so I want to end by saying this is something that we have to fight against. We have to recognize our own implicit biases against those that are aging, but we also have to work on our own self-perceptions to make sure that we are not telling ourselves that when we get older, we will not be able to. Instead, we need to think more about Maslow's hierarchy of needs and our self-actualization as we age, what we hope to become. Think of the positives, encourage the positives, and remember that you have some control over this, but it is our job to make sure that in our community it is a better place to live, where we eliminate as many of the isms in our community as we can.